Throat pain is any reason that can cause pain in the throat or discomfort or, a difficulty in swallowing, or even sometimes we don't pay attention to it. Even burning sensation in the throat because of acidity can also be can be called throat pain. The most common causes of throat pain that we see mostly in clinical practice would be because of infections, both viral and bacterial, along with, in middle age and patients in India, acidity is a very common cause of throat pain, along with other causes like allergy and pollution. These things also cause throat pain. So most definitely, environmental factors like pollution can cause sore throat. They irritate the mucosa, the lining of the throat, which causes this inflammation can cause a sore throat. Pollution, allergens present inside the air, they all can trigger a response. Most commonly, throat pain can present even alone as just pain in the throat while having food or drinking water. But it can also be associated with other symptoms like body pain, fever, a runny nose, cough. These things can also be associated with throat pain. Ideally, nothing should be ignored. It might be something very trivial, but it's always better to get it tested. And if at all it is something, better to get it identified at an early stage and take treatment. Because the earlier you find something out, the easier the treatment for it becomes. It is unlikely if it is just a sore throat, but it's always better to get tested. But if it is associated with other symptoms, like you're having difficulty in swallowing the food, or you notice some kind of change in your voice, or you are having difficulty in breathing, or there is some kind of sound that is coming with every time you breathe. These kind of things are warning signs to, get yourself checked as early as possible. When a patient presents to us with throat pain, first of all, the most of the information is obviously given in careful history taking of the patient. How the person's story is what matters the most. Apart from that, obviously, examination we will see as to if there is anything in the inside the throat like inflammation, which can be anywhere inside the mouth or going beyond. Things like lesions in the teeth, tongue, gums, tonsils, the back of throat, larynx, which is the voice box, they all can cause sore throat. So, if at all something is suspected, we can take a swab from the throat and send it for testing to look for any pathogens. Or if required, we can even do a endoscopy where we just put a camera, small camera, to the back of your throat and look for any abnormalities if it's there. Treatment options depend on what is the cause of your sore throat. If most commonly things like bacterial or viral infections of the throat are normally treated with, symptomatically. In case of bacterial infections, you can give antibiotics, but it's always better to determine which kind of infection you're having and then proceed with the treatment. Otherwise, even things like allergy and acidity can also cause throat pain. So, in that, anti-allergens or antacids can also help. The home remedies which people can mostly use are like it's always better to stay well hydrated, take water, plenty of water, and along with that, warm saline gargles. Just take very, lukewarm water and add a pinch of salt to it and gargle using that. These kind of things also help. Obviously, having food on time, not, having dinner very late or skipping meals. These things help in sore throat. The differences are not very clear cut, but with the associated symptoms, we can kind of determine whether the infection is caused by a bacteria or a virus. Mostly in viral diseases, they are accompanied by body pain, runny nose, cough, these things, and bacterial infections. We can find white patches over the tonsils, or slough present inside the mouth, enlarged lymph nodes, very high grade fever. these kind of sort of help us determine whether it is bacterial or viral. Otherwise, the most confirmatory tests would be to get a throat swab or a complete blood picture. Acid refluxes are when the stomach acid is pushed back into the throat. So when that happens, this acid kind of burns the mucosa of your throat. That causes throat pain. Most of the times, these things happen post meals or late at nights or early in the mornings. Um, the most common reasons for them are lifestyle factors. People who have dinner very late or have a very sedentary life, or dietary habits like having very spicy, oily food most of the time. These can trigger reflux related sore throat.